Hi there, and welcome to the eBuvet Academy presentation on tools for advising clients on medical problems. This presentation covers the basics and is aimed at all front shop staff. So we're looking at our receptionists in our clinics, as also those people working in vet shops. And the idea behind this presentation is to give you the tools that you need to give the clients the advice that they seek. So I hope this is going to be useful to you and that you're going to learn a lot from it. Please have a notepad nearby and write down any questions that you may have. And it's important to discuss those questions with your mentor or your vet in your clinic or myself, so that we can make sure you feel equipped and have the right information to deal with the clients. So the first thing I want to chat about is trust. It takes a long time to build up trust with the client and to build up trust with our brand. And the only way that we can build that trust and maintain the trust with our clients is to be sure that we give the right advice to every client every time. No pressure, but part of that is being educated and being confident in what you say, and also making sure that you continue to ask questions and continue to improve your knowledge. So even though you may have been working in this setup for a long time, there's always something to learn and there's something to grow. And there's no shame in saying that you don't know. So if a client does present you with a question and you don't know the answer, rather than giving them the wrong answer, say to them that you don't know, you'll find out, and make sure that you do find out and get back to that client. And that in itself builds a lot of trust with that client. And remember, it's not just your shop or your clinic that you're working in that we need to maintain trust with, but it's the entire eBuvet brand. And that's why it's so important to us that each person feels equipped to deal with each client that comes through the door. The other thing that's very important to realize is that we're all on the same team and we're all fighting the same fight. So we have a huge privilege being in the front shop, that we're able to really be on the front line. And there's so much misinformation out there on the internet and Dr. Google and all sorts of things that people try, and we have the privileged position to give them the correct information. Your advice can mean the difference to the animal and make a huge difference to the animal and shorten its suffering as well. So it's really critical to give the client the right information. Right, so we're going to go on to the basics. So let's start at worms. So you can see there's a horrible tapeworm here in the top right hand side of the frame. Worms are unfortunately a fact of life, and many of our pets are exposed to worms, and there's many different ways that they can get worms. So we'll often have clients say that their pets never go outside and they never get exposed to any other animals, but there is still a chance that they may pick up worms in different ways. So if we go through a basic deworming protocol, we look at puppies and kittens. So we deworm them at 2 weeks of age and every 2 weeks thereafter until they come for their vaccinations, and then the vet will advise them from there. So the reason that we deworm them every 2 weeks is that puppies and kittens can actually get the worms from the uterus, so they can be born with worms and they can get worms through their mother's milk as well. So we really want to nip that in the bud as soon as they're born. Bear in mind that if you're deworming one pet in the household, you do need to deworm the entire household as well. So definitely in the case of puppies and kittens, you want to deworm the mother and any other animals, and then consider deworming the people. Not every 2 weeks, but once off. For most other animals, we would recommend every 3 months deworming, or 4 times a year. So it just depends how you want to say it to the client. And that's just as a maintenance for the average animal that stays mostly at home or goes for short walks. We do have a high risk category, so those would be animals that roam a lot, as we're looking at cats that are walking kilometers per day, or dogs that also walk in sort of more felt area, or come into contact with a lot of animals that are going to puppy daycare or going to kennels. Dogs that eat bugs, it's critical to deworm them, and cats as well, deworm them more regularly. And then if they are on a raw diet, then we need to deworm them more regularly. So in that case, we would deworm monthly. So that's just your general maintenance and your basic protocol for deworming. if you do have a client that comes in and they say the animal does have worms, so they've seen little rice granules at the anus, or they've seen long stringy worms that look like spaghetti, then we need to be a little bit more aggressive. So then you would deworm on that day, and then every 2 weeks for 3 to 4 treatments. So you're looking at about 2 months of deworming. The reason we do it so frequently, if they do have worms, is because once you give the dewormer, it kills all the adult worms that are in the intestine, and then you have a whole lot of sort of immature worms that are sitting in the wall of the intestine. And as soon as the adults are gone, those ones mature and they come into the intestine. And that happens on about a 2-week cycle. So we then kill off those adults, and then the next batch of immatures come through, and we need to kill those off as well. So it's very important to warn clients up front that that is what's necessary. Otherwise, they'll give the dewormer, come back to you in 3 weeks and say, it didn't work, my dog still has worms. So you really do need to prepare them for the process, and I would suggest selling them the dewormer for the whole cycle, and make sure you write on the packet, give this one today, give the next dose in 2 weeks, and so on. Put the dates that they need to give that, and then they're prepared and they know exactly what to do, and you also create the right expectation in that client. There's a lot of questions about which dewormer to use. So most of the dewormers on the market that are in a tablet form will do both your roundworms, your pinworms, and your tapeworms. So you can really just take whichever one is stocked in your shop or in your clinic. External parasites. This is a really, really critical thing. So you can see over here we have a tick that's burying into a human skin, and this poor little dog is covered in ticks and fleas. So external parasites are easier for us to see, and they're also just as deadly and just as gross as what worms are. So when we talk about ticks, these are parasites that transmit other parasites that cause tick bite fever, and that can be deadly for both dogs and cats. So it is critical that we treat for ticks. In the Western Cape, our tick season tends to be more in the winter months, so we see a spike then, but throughout the year. So it's critical to treat for ticks every month or throughout the year, depending on which product you use. For fleas as well, so being coastal, we don't get as cold as the rest of the country. We don't get frost in the winter, so fleas like to be part of our family for the whole year round. So it is critical to keep on treating through winter. A lot of clients will stop giving tick and flea medication through winter, and then what happens is they just build up a bigger and bigger egg load in their household, and it's difficult to solve the problem later when they have a big outbreak in the summertime. So encourage your clients to treat for ticks and fleas year round. And there are a lot of products on the market available, and I'm sure you've had product training and the pros and cons and things like that. So in veterinary medicine and medicine in general, we always look at risk versus benefit. And I always explain to clients that the risk of getting a tick-borne disease and getting sick or even dying from it is very high compared to the risk of getting side effects from a tick or flea medication. So we always look at that. And in my opinion, there's a lot more benefit for giving the medication than letting the animal be exposed to those parasites. Right, so just a little bit more information here just to put it in perspective and really lay it home. So you can see this beautiful picture of the dog licking the child's face, and when I think about parasite control, I always have that picture in my mind. So what are we actually doing is we're trying to make the animal as healthy as possible so that we can have a wonderful relationship with our pets at home. So if we look at hookworm, it can lay up to 30,000 eggs per day, which is a huge amount. Those eggs can stay in the soil for up to 10 years, and they can be picked up through your skin. So if you think of children playing in sand pits or making mud pies outside, this is where the children would get exposed to this worm. And it is unfortunately one of those worms that affects humans as well as animals. So part of treating our pets for worms is to keep the humans safe in the household. tapeworm. This is another one of those lovely worms that can be transmitted from animals to humans. And this is something I'm going to show you a picture in the next slide. It can affect intestines, it can affect a person's liver and their brain. And this can be a deadly worm as well. So it's really a huge responsibility that's placed on us to make sure that our clients are informed about deworming, and make sure that every single animal or person that comes through your doors, that you ask them, when last was your pet dewormed? It's so easy to give them that information and motivate why they need to do it. Right, so fleas, as I said, they can be annoying to the animal and to the people. Many dogs and cats have flea allergies as well, and this can cause a huge amount of suffering. So we don't want them to have to sit with being itchy and having skin disease as a result of fleas. Fleas can also transmit a whole lot of diseases like cat scratch fever, plague, which luckily we haven't seen in a long time, and then cats feline infectious anemia, which is similar to tick bite fever. And the other thing that's important to realize is that fleas and tapeworms are in the same life cycle. So if you see a pet with tapeworms, you need to make sure that you treat it for fleas as well. And if you see a pet with fleas, you know they most likely have tapeworms too. So it's an easy sale, it's an easy way to motivate. So if you're treating for fleas, make sure you deworm. If you're deworming, make sure you address fleas as well. And then ticks as well, I mentioned, and tick bite fever. There's two different types, and many people think that your pet will only get ticks if they walk in long grass or in the veld. But in our area, we are privileged to have quite a lot of wildlife. So I know in my garden we've got squirrels that come in, hardy-daws, guinea fowl on a daily basis, and these wild animals will bring the ticks into your garden as well. So even if the person's animal never ever leaves the garden, there is still risk, and they still need to treat the animal for ticks. Right, so now you see this picture and you may be wondering what you're looking at. This is a cross-section of a brain, and all of these little circles with little things in them are actually cysts, and those cysts are caused by tapeworms, and those little white areas are the immature tapeworms sitting in there. So I'm not sure what animal or person this brain comes from, but I can tell you that this person would not have been well, and this is probably why the person or animal passed away, is from these tapeworms sitting in the brain. So it's quite a sobering picture to look at, and something that we're not always aware of, that it can be such a risk. So where do animals get these tapeworms from? First of all, from fleas, as we just mentioned, from the soil, and then from food. So cows and pigs can both be what we call vectors, so they can both carry these worms, and then when they are processed in the abattoir into beef or into pork, then they do check the carcasses to make sure there are no worms, but it's very difficult to find sometimes, and so we could be getting these tapeworms in our food. And that's why as humans we're taught we need to cook our food, and part of the reason is so that we don't get these worms, because if you cook the food it kills off the eggs and the immatures in the meat, and then you won't get the worms. So this brings me to the next big thing, is raw food, and this has become a huge trend in our animals to feed them more in a natural way and to feed them raw food. But when we do that, then these worms become a huge risk for our animals and for the people sharing the household with that animal. So that's very important to bear in mind. So that brings me to my next favorite thing to talk about, is raw food. So as I said, this has become a huge trend throughout the world, that people are trying to feed more naturally, and there's lots of arguments for and against feeding more naturally. I'm not a nutritionist, so I can't give too much information on how to balance the diet and so on, but the fact is there are a lot of people that believe in raw food, and there are some animals that do well on raw food. As a vet, I always recommend that people rather go with a good quality commercial diets, such as the ones that we stock in our shops. We know that those foods are properly balanced, that they're nutritious, that they're safe and healthy, that there's many checks involved. Those products are all registered as well, so there's a whole barrage of tests that each product needs to go through, and quality control that each product needs to go through. So a commercially available food in a pelleted form or tin form is always going to be the option that I would recommend to the client. But regardless of what I say, there will be people that will feed raw food, and we need to be equipped to talking to them about it. They often feel very strongly about choosing raw food for their pets as well. So it's important to go in with a sympathetic and understanding point of view, not to be attacking towards the person, and just understand and hear where they're coming from, and then explain to them the risks and how to try and decrease those risks for the animals. So firstly, worms are a huge risk, and I will remind you about that picture that I just showed you. So the tapeworm is a big risk. So to try and decrease that risk, it's important to freeze the meat. So freezing can also kill off some of those eggs from the tapeworms as well. Freeze and then defrost it and feed it to the animal. And then, as we mentioned previously, you want to deworm those animals more frequently, so on a monthly basis, and make sure you control fleas as well. Then we have two common bacteria, Salmonella and Listeria. So these are bacteria that can contaminate meat and can contaminate surfaces that the meat comes into contact with. So it's important to warn the clients to think about the dog bowls, to think about the counters where they prepare the meat, the knives. They need to be very conscious on keeping those surfaces clean and making sure there's not cross-contamination. So they shouldn't take a chopping board that they use to cut up the raw meat for the dog and then cut up their stew meat later for that evening. That could cause contamination to other members in the family. And they have to be absolutely meticulous with hygiene in the kitchen and the dog bowls. So those bowls need to be cleaned after every meal and disinfected, and that is a huge thing. I mean, there are cases where people in the household have gotten these diseases even though the animals didn't show any symptoms. So it's very important to just warn people about those risks. The other thing that often creeps into raw food diets is bones, and people think that the animals need the bones for the calcium, which is partially true, and that is what's tricky about the raw food diets, is it's difficult to make sure all the minerals are in the diet that they need. Bones can be a huge risk for animals. So if you think of how the food goes through the body, it starts in the mouth and through the intestines and it goes all the way out the other end. Bones can cause a problem at every level. So I've seen many animals with broken teeth and with bits of bone stuck on their teeth. I've seen many animals swallow whole bones, and these get stuck in the chest, in the esophagus, in the stomach, in the intestines. And then some animals would chew the bones up so finely that it forms almost like a cement, and then that blocks up the whole colon and they become extremely constipated. So first of all, it's expensive to treat these animals. It's not nice for the animals to suffer side effects from eating bones, and it's painful and it's stressful for them, and they often have to be in hospital for a few days. And in some cases, despite all of our best efforts, there's nothing that we can do, and they often pass away. So I really strongly advocate against giving dogs bones. If you do have a client that wants to treat their dog with a bone, then a big knuckle bone with a lot of cartilage on it is a good option, and they need to monitor that when the animal is chewing that bone. So if they see all the cartilage has been chewed off and they're starting to get to the hard bone, then they need to take that bit away. That's the safest way of killing a bone. So yeah, my take homes from this slide is, if people want to feed a natural homemade diet, then I understand that. It's maybe not my recommendation, but I do understand that. But then advise them to rather at least freeze and even better cook the food. And then you eliminate a lot of the risks that I've mentioned. And that's exactly why we cook our food as well. So I often mention to clients, we don't eat a raw pork chop, and it's for that same reason. We don't want to pick up the parasites and we don't want to pick up the worms. And then I always just casually mention, how do we know that that diet is balanced? I know when I pick up my bag of Heels that diet is balanced. There's many scientists that have put years and years of research into every bag on the shelf, and we don't always know that the raw food is properly balanced. Okay, So we can put all of the ticks and fleas and worms behind us for a second. And I'd just like to speak to you about vaccinations. So this is something, again, that there's a lot of debate out there. There's a lot of chatter on social media about vaccinations and side effects and things that are there. And people are generally not educated about it. They don't always understand how it works. And there's a lot of fear around vaccination as well. So first of all, why do we vaccinate? Why do we go through all that effort of vaccinating? And the biggest reason for that is so that we can prevent disease. And there are some horrible diseases out there that can cause illness and can cause death in animals. And we're privileged to have safe and effective vaccines to prevent that from happening. I'm recording this presentation right in the middle of the COVID-19 pandemic. And we've all seen what happens now when a virus goes unchecked and there's no vaccination. It has a huge impact. And the same in our animals. So it's really, really critical to talk about vaccination. If you have a client that comes in and they're all excited and they're showing you pictures on their phone of their new puppy or kitten, and they're coming to buy a dog ball and a cat bed and the first bag of food and toys and things like that, it is so, so critical. You are the person on the front line. You can give them the information. It's critical to talk to them about vaccination. Even in a vet shop, that might be the only contact that somebody's going to have with somebody who knows. So please talk to them about vaccination and mention that they do need to go to their vet to get vaccinated. So if we look at cats on the left, there are a few diseases which we vaccinate against. So snuffles. Snuffles is just a big group of different viruses that cause the same sort of symptoms. So these cats look like they've got a cold. They'll often have a runny nose, runny eyes. Some of the viruses cause big ulcers on their tongue and at the back of their throat. It's generally not a deadly disease, but it is very uncomfortable for the cats, and some cats need to be hospitalized because they stop eating and they feel very, very unwell. And in some cases, with the herpes virus being one of them, it can become a lifelong problem for that cat. So vaccination is really a great way to prevent them from becoming ill, and if they do manage to get the virus somewhere along the line, that they get a milder form of the disease. So that's one of the big things we vaccinate against in cats. Panleukopenia as well. So this is also a virus that can make the kittens and cats very, very ill. It's similar to parvovirus, which I'll talk about in dogs. And it's fortunately something we don't see very often. And I think the reason for that is that we vaccinate our cats. So that's wonderful. The next one that I'd like to speak about is FELV. So that stands for feline leukemia virus. And this is an absolutely horrible virus. It is in the same kind of family of viruses as AIDS in people, and it is transmitted by biting and fighting, and even within a household, transmitted by licking a dish or sharing a food bowl with a cat that is infected. It's a disease or virus that goes and sits in the cat's body, can sit there for a long time before making the cat sick. So in that whole time, it will be infecting other cats as well. And when the cat becomes sick from this virus, there's often no treatment and they often die. So it's a horrible disease, and it is preventable with vaccination. And then the next one is rabies. So this is one of those zoonotic diseases, a disease that's transmitted from animals to people. And rabies is a big, big problem in our country. Fortunately, not such a big problem in the Western Cape, but it's just a matter of time. So we are required by law to vaccinate all cats and dogs against rabies. If they're older than 12 weeks, we have to do that. And at least every 3 years, they need to be vaccinated. So this is absolutely critical. People don't know that they have to do that. And should there be a rabies outbreak in our area, if you can't prove that your animal is vaccinated against rabies, the state vet has the right to then euthanize that animal. So the impact of not vaccinating your animal against rabies is huge. Not only that, it can be transmitted from cats and dogs to people as well. And most people will get rabies from a cat or a dog that is infected. So by vaccinating our pets, we form a barrier between an infected wild animal and ourselves. So it's very, very important to do that. So we vaccinate kittens, at 9 and 12 weeks of age, and then every year thereafter for most of the diseases. So that's important. When they come in for that first bag of litter and they're super excited, please mention to them that they should be taking their kitten to the vet for a vaccination. And if you're working in reception as well, cats get neglected. So many people will bring their cat in for their vaccinations as kittens and their sterilization, and we don't see that cat again until it's 12 years old and it's got kidney disease or something like that. So it's absolutely critical if you're working in reception and a person's coming in to buy cat food to always check when last was the cat vaccinated, when last did we see the cat, and remind them that cats also need vaccinations on an annual basis, particularly against leukemia virus. That vaccine only lasts a year. So it's very, very important to chat to the people about that. And everything we do and everything we recommend is for the animal's best interest. And if we're looking after the animal, we look after our company as well, because we're seeing those animals more often and we can also intervene more often. And that builds trust in the client. Okay, great. So dogs. Dogs, you can see, have a lot longer list there. So they also can get rabies. So it's the same, older than 12 weeks and every 3 years at least for rabies. But for me, the first two diseases on the list, parvovirus and distemper, are the ones that we really need to be worried about. So parvovirus is a horrible, horrible virus. It's also called cat flu or katgriep. It was actually a virus that was in cats and it mutated into dogs a couple of decades ago. So parvovirus can, if the animal goes untreated, it will kill 9 out of 10 dogs. It's a very serious virus. If it does undergo treatment, then we've got a 50-50 chance of saving the animal, and normally they're in hospital for at least a week, and there we're looking at a bill of 10 to 20,000 rand to try and pull that animal through. So it's a horrible disease to treat. It's a horrible disease for the animal to have. It's painful and they vomit constantly. They have a horrible bloody diarrhea. It's horrible to see, and it's completely preventable via vaccination. So there is no excuse as a dog owner to not vaccinate your pet. A lot of people say vaccinations are expensive, but vaccinating your pet is going to be much cheaper than treating it for parvo or losing your pet to parvo. So it's critical when they come in all doughy-eyed with their puppy pictures to remind them to take their puppy for vaccination. The other disease, which we don't see all that often in our area, but in some other areas and in areas where there's not a high level of vaccination, is distemper. Distemper is also a virus, and it normally starts with a runny nose and a cough, and they get vomiting and diarrhea, and then they get a neurological condition, so they can start seizuring and all sorts of things can happen. It can also be deadly, and again, completely preventable via vaccination. Infectious canine hepatitis is another one, but luckily we don't see that one too often. And then kennel cough. This one luckily is not a deadly disease normally, but it is highly contagious and it spreads very quickly between animals. So we try and slow down that spread and prevent people from having sick dogs, prevent them from having to come see us for sick animals. We'd much rather see healthy animals every day and vaccinate them and keep them healthy than neglect this prevention and we have sick animals. So vaccination is absolutely critical. In dogs, we vaccinate from 6 to 8 weeks and then every 4 weeks thereafter until they're about 14 to 16 weeks. So most animals will have most dogs will have 3 sets of vaccinations, sometimes 4, depending on when they started. And then ideally we want to see these animals annually. So every year. There is a movement away from giving vaccinations to dogs every year, but we still want to see the animal every year. And in that consultation, we discuss the risk. How many other animals does this dog come into contact with? When last were they vaccinated? Should they be vaccinated? So we have that conversation with the client. But that really, from a front shop point of view, you should be recommending an annual visit for every cat and dog to the vet. And that is really critical. It's so much more pleasant to treat an animal early and pick up something early and prevent a disease than have to walk that path with a poor sick animal. All right, so next is health checks. So I've just touched on that already. So from 0 to 7 years, so as an immature or puppy or kitten in the first year, and then as an adult animal to 7 years, we do want to see them every year, as I mentioned. Once they cross over to the senior side, we would definitely have to see them every year, and in many cases every 6 months. So as they cross over to senior phase, they have a lot more wear and tear, and they're predisposed to a lot more other conditions like arthritis and kidney disease and heart disease. And in those patients that we're picking something up and we're concerned about it, we want to monitor them more regularly and make sure they're okay and make sure they're getting the right treatment. Sterilization. If you're part of the EBAVET group, you know about the EBAVET CVC work, and that's in areas where people can't afford veterinary care for many of their pets, and there is a huge overpopulation issue in those areas. But in general, there's a huge overpopulation issue. So sterilization is absolutely a big way to deal with that overpopulation issue. What many people don't realize, it's required by the City of Cape Town. It's in our bylaws. So if you have an animal and it's not registered for breeding, it should be sterilized. So that's very important to also mention that to clients when they come in with an animal. And it's really the only way to get the overpopulation under control. The general rule for sterilizing an animal is that we can do it any time from 6 months of age. There are some exceptions to that, but being in the front shop, that would be my recommendation. So if people have queries about the timing, it's best to discuss that on a one-on-one basis with the vet, where we will then assess the patient, assess its risks given its breed, and also then give a recommendation personally for that animal. But most animals need to be sterilized from 6 months of age. And I'll explain to you a bit more in this slide. So just a little bit of basics of reproduction. So cats go through puberty anything from about 5 months to about 7 months of age. Cats are seasonal breeders, so that means that they will start coming on heat as the days get longer. So spring and summer, they'll come on heat. And it's often in those times where cats start roaming around more. You'll hear the cats fighting in your area. They're all fighting for territory. They're fighting for mates. We see a lot more cats in the spring and the summer from bite wounds and abscesses and things like that. So that's one reason to sterilize your cats, is they're less likely to get injured if they don't come on heat and if they're not intact, because they're more likely to stay at home. So that's quite important. And then also they transmit diseases like feline leukemia and feline AIDS through biting and fighting. So we stop the spread of those diseases by sterilizing our cats. So there's huge health benefits from that point of view. The cat's heat cycle, they come on heat for 7 days and they go off heat for about 7 to 14 days until they fall pregnant. And this will happen continuously through the spring and the summer. So that can be quite annoying as an owner, because when a cat or a queen comes on heat, she becomes a monster and she will yowl and make a noise and try and get out and escape, and become quite impossible to live with. And that keeps on going until they fall pregnant. And cats are very effective breeders, and they can easily have 2 litters of kittens in one breeding season. So you can see how quickly the population can get out of control if we don't sterilize our cats. So definitely for cats, we want to be sterilizing them at 6 months old. If you have a kitten who's going to be 5 months old at the beginning of spring, I would recommend we sterilize them a little bit earlier, because they might come on heat earlier. In dogs, they will go on heat for about 2 to 3 weeks every 5 to 9 months. This will happen also from about 7 to 9 months of age. It is quite difficult to live with a dog that's on heat, particularly if it is a large breed dog. So they will have a bloody discharge for that 2 to 3 weeks. So it can be quite messy to deal with. And then also male dogs have an amazing sense of smell. So you will get visitors from far and wide that will be coming into your yard and jumping fences to get to your female, and it also encourages a lot of fighting and bite wounds if you have a dog on heat in your garden. They are generally only fertile in the last few days of their heat, and that's when the male dogs will really start coming. Every time a dog goes through heat, the uterus lining becomes thicker and thicker, especially if they don't fall pregnant when they go through that heat. So that puts them at risk for pyometra. Pyometra is a condition where the uterus gets very infected and ends up swelling and getting full of pus, basically, and it can be deadly for the animal as well. So we see this very, very commonly in unsterilized female dogs, bitches, when they are, anything from 5 to 10 years old. And it's quite common in that case. It's much more difficult to deal with a pyometra than it is to sterilize a young animal. And the reason for that is a pyometra dog will be an older dog normally. They've been sick now, and they have maybe other concurrent conditions, and it becomes a much bigger story to treat that animal than it would have been to sterilize them when they were young and healthy. So that is very important for people to realize that can happen. So the big risks of keeping your animal unsterilized is that they could fall pregnant and you sit with a litter of puppies and kittens and you struggle to find homes for them. Pyometra, and then also mammary cancer. So this is milk gland cancer, or the equivalent of breast cancer. So the risk of having mammary cancer increases with every heat, particularly in dogs. So we really don't want that to happen. So that's quite critical. So there's a lot of misconceptions and old wives' tales about allowing them to have a litter, allowing them to have a heat, and if you don't, their personality will change, and there's all these sorts of things out there and that make people very worried. For me, the bottom line is we don't want our animals to struggle with unwanted litters, we don't want pyometra, we don't want mammary cancer, and the only way to prevent that is to sterilize them. In some cases, so large breed dogs, it is a good idea to let them have their first heat, but it's not about them having their first heat. It's about them actually growing to maturity. So if you have a large breed dog, we rather want to sterilize them closer to a year of age, but it really is a personal decision depending on that dog's risk. So my general recommendation would be from 6 months, and if the person wants a specific recommendation for their animal, then it's best to consult with the vets. Male dogs also have risks for not being sterilized, so they do tend to get into fights more. Male dogs and cats get into fights more, they get injured more, get hit by car more if they are not sterilized. So that's a risk. And then behaviorally as well. They can sometimes become more aggressive and they can mark in the house, which is not something that any of us want. So there is some motivation for male dogs to be sterilized as well. Not as big health benefits as for females, but it is always worth considering. Right, dental care. So this is critical. Most dogs over the age of 3 have some dental disease, and it's quite sad to see that they struggle with sore teeth. If any one of you have had a sore tooth, you know how horrible that is, and we all dread going to the dentist, and the only way to prevent that is by instituting good dental care. So the first thing to do is look at good quality food. This is one of those instances where dry food is better. So it doesn't stick to the teeth as well, and especially if you're using a veterinary-based food, it helps to prevent tartar and calculus build-up and plaque build-up on the teeth. So that's critical to do. It is advisable to brush a dog's teeth, and brushing regularly, so daily is best, but anything is better than nothing. It's important to start brushing when they are young to get them used to it, if you can, but in many cases, in many cats and dogs, they won't tolerate that, and we understand that. So the next best thing is annual checkups again. So it's another reason why animals need to come to the vet every year. We always check. Every time they come in, we check their teeth, but particularly in the annual checkup, we check their teeth. And if we see it's starting to build up, we rather do a preventative dental scale and polish than allow them to get this really rotten, horrible mouth, which will be painful and has risks in itself. So dental care is critical. And again, when that puppy or kitten owner comes in, it's something to talk to them about. So we really want them to go out of their experience with you with a whole lot of information. They need to know about deworming. They need to know about tick and flea prevention. They need to know about vaccination. We can start looking at dental care. They need to know about sterilization as well. So that's where it's so important for you to look at each person that comes through the door and realize that this is an opportunity to make an impact on that animal's life and improve the animal's health so that that client has the longest, happiest relationship that they can have with their dog. Great, so that concludes our basic video. Be sure to watch the next video, which is going to cover medical problems and going to give tips on how to advise clients on how to deal with those. Thank you so much.